Assalamu alaikum wa rahmatullahi wa barakatuh. We will discuss today bleeding rectum. What is the definition of bleeding rectum? Bleeding rectum meaning passage of blood from the rectum. One of the most common complaints in surgery clinic is bleeding rectum. A lot of patients came to the surgery clinic complaining from the bleeding rectum, passage of blood per the rectum. Patients are of two types. Some patients say that the blood is fresh, bright red blood, which is called hematochezia. Fresh, bright red blood passed through the rectum is called hematochezia. The other patients complaining from offensive black hairy stool, sticky black stool, not bright red blood, which is called melena. What's the difference between these two items, hematochezia and melena? If the cause of the gastrointestinal bleeding above the ligament of Treitz, what's the ligament of Treitz? Ligament of Treitz is peritoneal condensation which suspend the DJ, duodenojejunal junction. The junction between the duodenum, fourth part of the duodenum, and the jejunum is suspended by a peritoneal fold called ligament of Treitz. Bleeding below the ligament of Treitz is called lower GI bleeding, while bleeding above the ligament of Treitz is called upper GI bleeding. What's the difference? Upper GI bleeding causing melena. Why? Because the blood pass on the digestive enzymes leading to formation of what's called acid hematine, leading to melena, black stool, which is a digested blood. Black stool is a digested blood, while lower GI bleeding causes blood doesn't digested by the digestive enzymes, so it's bright red blood. So bleeding above the ligament of Treitz is called upper GIT bleeding, leading to melena, bleeding per rectum, melena, while the lower GI causes hematochezia, which is bright red blood. What are the causes of the gastrointestinal bleeding? There is a general causes of bleeding tendency, like hemophilia patients. Patient has which have a bleeding tendency to bleed from any side of the body, like the joints, the GIT, the brain. So this patient is susceptible to bleeding from inside, and the GIT is a site of bleeding in the patients of bleeding tendency. So the first step of management of the patient with gastrointestinal bleeding, either upper GI or lower GI bleeding, is coagulation profile. Coagulation profile to detect the general causes of the bleeding, BT, BTT, INR, which detect the coagulation profile of the patient, bleeding tendency of this patient. If the cause is general cause and I search for a local cause and give the general cause, the patient will continue to bleed without any management. So the first step is to do coagulation profile for a patient with gastrointestinal bleeding, either upper GI bleeding or lower GI bleeding. What are the causes of melena, upper GIT? Any cause above the ligament of Treitz. What's meaning? Any cause from the oral cavity, esophagus, stomach, and the duodenum. We say that the ligament of Treitz is the landmark at the end of the duodenum. So any cause in the esophagus, stomach, duodenum is leading to bleeding per rectum, but melena, which is dark, tarry, offensive stool, sticky, digested blood. What are the causes? The most common cause in Egypt is esophageal varices. Esophageal varices due to liver cell failure, mostly in Egyptian splenomegaly patients, leading to upper GIT bleeding, which pass blood through the rectum, is called melena. Malarivious tear. Malarivious tear is a common tear which occurs in a patient with alcoholism, and stomach causes ulcers, acute gastritis, cancer stomach. Ulcers and cancer are one of the most common causes of upper GIT bleeding. It's the second common cause of the upper GIT bleeding is ulcer and acute gastritis. Then cancer stomach, duodenal ulcer is one of the common causes of upper GIT bleeding. So to summarize, upper GIT bleeding causes which leads to bleeding per rectum, which is called melena, ulcers, cancers, and varices. Most common in Egypt and Japan is esophageal varices. Esophageal varices common in Egypt and Japan. Is this esophageal varices into massive bleeding, upper GIT bleeding. So stomach ulcers and cancer stomach, duodenal ulcers lead to upper GIT bleeding. What are the causes of the lower GIT bleeding, which is called hematochezia, passing of bright red blood? Patients say that I pass a bright red blood per stool. From the jejunum, maybe polyps in the jejunum, like what's called Budd-Jigger syndrome, which is one of the syndromes leading to cancer, small intestine, inflammatory bowel diseases, which are common in Western countries like ulcerative colitis and Crohn's, ileum like jejunum, polyps, cancer, and inflammatory bowel diseases, and maybe Meckel's diverticulitis, diverticular disease, one of the common causes of bleeding per rectum in the childhood. In a child which is 10 years old bleeding per rectum, I must suspect Meckel's diverticulitis. And put it in the differential diagnosis of the bleeding per rectum in colon, polyps, cancers, inflammatory bowel diseases, and the most common cause of the massive bleeding per rectum in old age patients after 50 years is diverticulitis. Diverticulitis, one of the most common causes, first most common cause of massive bleeding per rectum is diverticulitis. So the causes of the upper GIT bleeding, which cause melena, dark tarry stool, which is ulcers, cancers, varices. Ulcers, peptic ulcer, cancer, esophagus, stomach, duodenum, and ulcers, cancers, and esophageal varices. To summarize, ulcer, cancer, varices. Ulcer, cancer, varices. The lower GIT bleeding, which is most commonly caused by polyps, lower GI polyps, and cancer, small intestine or large intestine, which is most common than small intestine cancer, inflammatory bowel diseases, inflammation, and diverticulitis, which is the most common cause of the massive lower GIT bleeding. What are the anal causes of the lower GIT bleeding, which is the commonest cause of the bleeding per rectum, hematochezia, is hemorrhoids. Hemorrhoids, piles, either internal piles or external piles, which is the most common cause of the bleeding per rectum at all. Most common cause of massive bleeding per rectum is diverticulitis, while most common cause of the bleeding per rectum is hemorrhoids, piles. Again, most common cause of massive, underline massive bleeding per rectum is diverticulitis, and the most common cause of the bleeding per rectum is hemorrhoids. What I mean by massive bleeding per rectum? Passage of 1.5 liters of blood, or by another words, the bleeding per rectum which necessitate transfusion of 2 units of blood. This is called a massive bleeding per rectum. The most common cause of massive bleeding per rectum is diverticulitis, while the most common cause of bleeding per rectum in general is hemorrhoids. So when a patient came to my clinic and complaining from bleeding per rectum, the first I must examine the anal canal to detect the most common cause of bleeding per rectum. The second is anal fissure. Anal fissure is one of the most common causes of the bleeding per rectum. Is injury to the anal mucosa leading to bleeding, and a very rare cause in the anal canal is anal cancer. So I must do BR examination, digital rectal examination, to detect mass in the anal canal in every patient of bleeding rectum. Again, the anal causes is important. Anal hemorrhoids, fissure, and anal cancer. To summarize the causes of the bleeding rectum is ulcer in the upper GIT, ulcer, peptic ulcer, cancer, varices, ulcer, cancer, varices. To summarize the causes in the lower GIT, bleeding, polyps, cancer, inflammatory bowel diseases, and diverticular diseases. Diverticulitis in the colon and Meckel's diverticulum in small intestine in young age people. The anal causes hemorrhoids, fissure, and anal mass. So, what's the presentation of the patient with the bleeding rectum? What's the presentation of any patient with bleeding rectum? We have two presentations: melena and hematochezia. Melena, tarry, dark, offensive, sticky stool, digested blood, while hematochezia is bright passing of bright red blood. How to reach a diagnosis? Bleeding rectum is a differential diagnosis lecture. How to reach a cause for the bleeding rectum? This slide shows the most common causes of blood in the stool in general. As we say, the most common cause is hemorrhoids, inflammatory bowel diseases in Western countries, colon polyps, constipation, which cause anal fissure, untreated bowel infections, and colon cancer. How to diagnose a case of bleeding rectum? At first, we must take a detailed history in the case of gastrointestinal bleeding. So the history including the age of the patient. We can categorize the patients of bleeding rectum by the age. In the infancy, the most common cause of the bleeding rectum is intussusception. The intussusception in the infants show the passage of red currant jelly stool. Red currant jelly stool. Jelly like material which has a red color. So it's like bleeding rectum. This is intussusception. A landmark for intussusception diagnosis is a good sign: red currant jelly stool. Red currant jelly stool in the intussusception. So if the mother came to your clinic, my baby have a stool, had a blood in the stool. So her baby is about 6 months in age. Is the infant. What's the most common cause in your mind to diagnose it? Bleeding rectum in a 6 months age infant. I show the dipper. The dipper show red currant jelly. So it's intussusception. I must ask for investigations for intussusception like ultrasonography, which is detect kidney shaped mass in the right iliac fossa in this young age infant, and exploration is a must. In the childhood, as we say, if younger child 5 years old, 6 years old, his mother see blood in his stool. So you must put on your mind the juvenile polyp. The polyp is the most common cause of the bleeding rectum in early childhood, 5 years, 6 years. In 10 years old boy, the most common cause of the bleeding rectum is Meckel's diverticulitis. And the diagnosis is very difficult. The diagnosis of Meckel's diverticulitis is by technetium 99 scan. Technetium 99 scan, we will see it in the end of the lecture. Again, infant 6 months up to 2 years, his mother complaining of bleeding rectum. My baby have a blood in his stool. So calm down, mom. And this is intussusception. If the boy 5 years old, what the cause of the bleeding rectum is juvenile polyp. So I must examine the anal canal and the rectum. I will feel the polyp. And then 10 years old boy have bleeding rectum. I must put in my mind Meckel's diverticulitis, and the second is this Meckel's diverticulitis is difficult to diagnose. This is the bleeding rectum by the age: infant, early childhood, late childhood, and young adult. Young adult, we say that the most common cause of the bleeding rectum is biles. In older populations, diverticulitis and cancer. More than 50 years old, bleeding rectum. So two options we have: diverticulitis and cancer. Inflammatory bowel disease in the middle age population, from 20 to 40 years old, inflammatory bowel disease. So again, from the history, I can diagnose the cause of the bleeding rectum: young infant, 6 months, 4 months, bleeding rectum, intussusception. 5 years old is juvenile polyp. 10 years old, mostly Meckel's diverticulitis. Young adult, the commonest cause is biles. From 20 years to 40 years old, mostly inflammatory bowel diseases. More than 40 years, diverticulitis and cancer. And cancer, the causes of the hematochezia or lower gastrointestinal bleeding. I will ask the patient about the type of the bleeding. As we said, the patient may have two types of bleeding: hematochezia and melena. So if the patient give me a history of having melena, black, tarry, offensive stool, sticky stool, not a bright red blood, I must put in my mind the causes of the upper GIT bleeding, the ulcer cancer varices, the causes of the upper GIT bleeding: ulcer, peptic ulcer, cancer, stomach, esophagus, duodenum, and varices, esophageal varices. So these three options in the melena. Hematochezia, the patient complaining from bright red blood on the surface of the stool, and part from or even apart from the defecation is from the anal canal. Again, bright red blood part from the stool, or not apart from the defecation, is from the anal canal. Yani blood on the stool itself. Bright red blood on the surface of the stool or at the end of the stool. Red coated around the stool is from the rectum or the left colon. Stool mixed with blood is from the right colon. Again, bright red blood on the surface of the stool, from the surface of the stool, or bright red blood without defecation, maybe from the anal canal, or red coated around the stool from the rectum, fully mixed with the stool is from the right colon. I will ask for associated symptoms. So I ask the age and the type of the bleeding. In the history, you must ask about the associated symptoms. For the upper GIT symptoms, I will ask about associated symptoms of peptic ulcer, epigastric pain, dyspepsia, heartburn, hematemesis, and if a patient is complaining from intussusception, abdominal colic, constipation, abdominal mass. I will ask for cancer symptoms like unintentional weight loss or cachexia, anorexia, anemia. If there is an inflammation in the rectum, proctitis, if there is a tenesmus, mucus in the blood. I will ask about the anal pain for the anal causes of the bleeding rectum. So, in the bleeding rectum cases, I will ask the age, the type of the bleeding, and the associated symptoms. Associated symptoms of esophageal varices is the stigmata of liver cell failure. Other symptoms of the liver cell failure like fine silky hair, ascites, lower limb edema, spider nevi, or whatever the other causes of the other symptoms of liver cell failure. Ulcers, the upper GIT symptoms like dyspepsia, hematemesis, epigastric pain, cancers, unintentional weight loss, cachexia, and loss of weight, loss of appetite, anemia. In the lower GI causes, I will ask about the symptoms of cancers like الكاشيكسيا, loss of weight, loss of appetite, anemia, inflammatory bowel disease. I will ask about diarrhea or another associated symptoms of the inflammatory bowel disease. If there is diverticulitis, left iliac fossa, pain, previous attacks of diverticulitis. I will ask about anal complaints like anal pain associated with bleeding. So it's the most common bleeding which is associated with anal pain most commonly is an anal cause of the bleeding rectum. How to manage a patient with the bleeding rectum. First of all, I will examine the patient, general examination at first, pulse, temperature, blood pressure. If the patient is shocked, we must be resuscitation of the patient by first lactated renal solution. If not responding to this resuscitation, blood transfusion. If there is 2 units of blood transfusion, it's a massive bleeding rectum. So patient must admitted to ICU for resuscitation. Examination of the patient, abdominal examination, detection of masses, like in the cases of cancers, or anal examination is very important to detect the anal causes of the bleeding rectum, to detect piles, fissure, or anal polyps or cancer. What are the investigations to diagnose the lower GIT bleeding? The first of all, we must exclude upper GIT bleeding. How to exclude the upper GIT bleeding? By insertion of NGT, nasogastric tube, Braille. Insertion of NGT, nasogastric tube, if there is no blood. If there is no blood in the upper GIT, the NGT has no blood. If there is a bleeding from upper GIT cause, NGT, Braille, have a blood. So it's upper GIT cause, I will do upper GIT endoscopy. If the NGT has no blood, so I will proceed for colonoscopy. Colonoscopy, as we see in this picture, this is a colonoscopy. This is a blood. It's a bleeding diverticulum. This is a bleeding diverticulum, as we see in this picture. Colonoscopy have the advantage to diagnosis of the cause of the bleeding rectum in the colon, and this first, and they can deal with this cause. Like in the second picture, this is a hemoclip which control the bleeding or controlling of the bleeding by cautery. So colonoscopy is the first line in the management of the lower GIT bleeding. After NGT insertion, rail insertion, exclude upper GIT bleeding, or if there is available upper GIT endoscopy, if not available rail, so colonoscopy is done. Colonoscopy has the advantage for detection of the cause of the colonic cause of the bleeding rectum. This is diverticulum, mouse bleeding from the diverticulum, and colonoscopy can detect the bleeding vessel at the mouth of the diverticulum and control it by hemoclips. So colonoscopy is the first investigation in the management of the lower GIT bleeding. Any patient with lower GIT bleeding must do colonoscopy. Colonoscopy is a must. Patient with bleeding rectum equal colonoscopy. Patient with bleeding rectum equal colonoscopy, even if this patient has a local cause in the anal canal. Any patient more than 40 years old, even if this patient have a local cause in the anal canal like piles, fissure, we must do colonoscopy to exclude the other causes of the bleeding rectum. We are talking about cancer, colon cancer. If there is a colon cancer and delayed diagnosis, we include this. So colonoscopy is the first line of management of bleeding rectum. If the bleeding is outside the colon, like from the GIT, we can do technetium scan. Technetium scan can detect the bleeding site in some cases, like in the cases of Meckel's diverticulitis. Meckel's diverticulitis, as we say, is a cause of the bleeding rectum in children about 10 years old. The characteristic of the Meckel's diverticulum, which has ectopic gastric and pancreatic cells in 2% of cases of Meckel's. The bleeding from Meckel's is due to ectopic gastric cells, secretion of acids leading to erosion of the mucosa, leading to bleeding. So we give a patient a tracer technetium 99, and this technetium 99 is detected by the gamma camera, and this is technetium is taken by the gastric cells and the ectopic gastric cells in the Meckel's diverticulum. So this is the technetium in the stomach, and this is the technetium in the ectopic Meckel's. Gastric cells take the technetium, and we detect the technetium by the gamma camera. Technetium is detected in the stomach and is detected in the right iliac fossa. The right iliac fossa gastric cells is in the Meckel's diverticulum. Technetium can diagnose the Meckel's diverticulitis cause of bleeding per rectum. The other is selective angiography. Selective angiography have advantage of detection of the cause of the bleeding per rectum, the site of the bleeding per rectum, and can selectively embolize this site. Embolization of the feeding vessel. Angiography can detect the site of the bleeding and selectively embolize the site of the bleeding, leading to stopping of the bleeding. This is called selective angiography, but not present in all centers and not available in all hospitals. In the past, if the cause of the bleeding per rectum is not detected, total colectomy was done. So the management of a case of bleeding per rectum, we must search for the cause. The most common cause is hemorrhoids, so anal canal examination, which include inspection and the palpation by digital rectal examination, is a must to detect the anal causes of the bleeding per rectum, hemorrhoids and anal fissure, which is the most common cause of the bleeding per rectum. Detection of other causes by history and clinical examination, ulcers, cancers, and varices in the upper GIT, lower GIT, cancer colon. We must put in mind cancer colon, inflammatory bowel diseases, and diverticulitis, which is the most common cause of the massive bleeding per rectum. The massive bleeding per rectum. Investigations: bleeding per rectum equal endoscopy. Bleeding per rectum equal colonoscopy. Colonoscopy have advantage of detection of the site of the bleeding, the cause of the bleeding is present in the colon, and can deal with this cause. Like we see in this picture, hemoclips are applied to the bleeding vessel of colonoscopy. In colonoscopy, technetium scan can detect the site of the bleeding in some cases, like Meckel's diverticulitis. Lastly, selective angiography can detect the site of the bleeding, but can detect and can deal with it by selective embolization. In the past, the total colectomy was done for the cases of obscure lower GIT bleeding. Thank you.